A local drummer, Skip, taking care of the most important beat, his heart. What he ignored that ultimately led to a quintuple bypass.
From the University of Kansas Health System.
I am amazed. The team here is great.
I came on a Tuesday, and then by Saturday I had a heart in me.
I have never seen a group of people work together so good as this team of heart specialists. I mean, it's just unreal.
Stand by to set up show.
And the Dolph C. Simons Jr. Family Broadcast Studio.
Roll it.
Always makes you feel like you're the most important patient on the planet.
I felt heard, and that was really big.
This is All Things Heart.
Good morning, I'm Alexis Del Cid. Welcome back to All Things Heart. Today we're talking about quintuple bypass surgery. Yes, there is such a thing. Sam Platt had blockages in 5 arteries supplying blood to his heart. That put his busy days and nights of playing music on pause. How long have you been drumming?
Oh God, since I was 5 or 6, so forever.
When Sam Platt performs, feeling his beats dancing with his own heartbeat, he can't remember a time he wasn't drumming. Drumming is a huge part of what makes Sam, Sam.
Like, it's the most fun instrument to play. You just got to carry more stuff, you know.
And before he got sick, this is where you could find him on stage, sometimes 6 nights a week, jamming out at the Green Lady in Kansas City. Even when he's not on stage, he's still drumming, whether it's rehearsing, teaching, or even conducting music therapy sessions.
I got to go to a hospital in Springfield one time where they gave me hand drums and they were doing experiments, and they found that hand drumming, like the patient actually touching the drum and you helping them do that, had like a way higher success rate than someone coming in and just playing guitar and singing you a song.
Sam never dreamed years later he would be the heart patient in the fight for his life.
Sam Platt on drums.
Although looking back, he realizes he wasn't running at a sustainable pace.
So I was playing a lot, and I just go, and I think I was eating whatever I wanted, and I would stop and get fast food on the way to the gig, and I was taking a blood pressure pill, but I wasn't really checking my blood pressure very much. I knew I needed to walk more, I knew I needed to exercise more, and I wasn't doing it.
On August 31st, it came to a head. Sam had just returned home from one of his typical jam-packed days, capped off with band practice at 10 p.m., and he had a terrible stomach ache.
I just felt like I had the worst heartburn ever.
At 4 a.m., he finally woke up his wife and had her take him to the hospital in Lawrence, where doctors didn't like what they saw. Next thing he knew, he was in an ambulance headed to the University of Kansas Health System.
Thank you. And they did that, and we're like, okay, wait, we got to pull in the big guns.
One of those big guns?
Hi.
Hey,
what's happening?
How's it going?
Good, man.
Thoracic surgeon Dr. Tyler Zorn.
You look good.
Yeah.
Soon, Sam was scheduled for open heart bypass surgery, and not just any bypass.
They did quintuple bypass, and I'm like, oh, like I hadn't even heard of that. I thought quadruple was like the most you could do.
Quintuple bypass. The last thing Sam remembers as he drifted off was Dr. Zorn asking him a question about his arms.
I think the last thing he said was like, is it okay if I take arteries and veins from wherever because I need to harvest?
Sam remembers saying, do whatever you need to do, and it was lights out.
We're so thrilled to have Sam joining us today in our studio, along with his cardiothoracic surgeon, Dr. Tyler Zorn. Thank you both for being here. And we should say Sam brought props. We're going to get to those in a minute. Oh, feel free. You want to give us an intro? Yeah, when's the last time you guys saw each other?
It's probably been about it. I mean, in person, probably well over a year now, which is a good thing.
Right. You love your patients.
Usually you want to see your cardiac surgeon more than once after surgery. So.
Sam, your quintuple bypass surgery was September 7th, 2022. So when we first met you, you were meeting Dr. Zorn first time post-surgery. It was your post-op, right?
Mm-hmm. Yes.
How are you feeling today?
I'm great. I feel great. Wonderful. Totally changed my lifestyle. They gave me a diet in the hospital of low sugar and low salt, and I've just been doing the same diet. And I think Dr. Zorn told me to walk, and then I went to see Dr. Curian, and he was like, you have to walk an hour every day. And so I walk an hour every day.
You look great.
Thanks.
You really do. Your coloring even looks different.
You
look better. How do you feel when you play your gigs? Do you have more stamina?
Yes. It's hard to judge because you're kind of in your own skin all the time and you don't notice the big changes. But yeah, time is flying by, and we have our little routine that, you know, when we play and have little breaks, and I walk around the club or walk outside on breaks, and it does seem easier now, a lot easier.
So that's where you get some of your exercise in?
A little bit. I don't really count that in my hour.
Right.
But
you're just active.
Yeah.
So when we go back to the night that you finally went to the hospital in Lawrence, what did they initially see that was so alarming to them?
Well, I think it was a dissection in my my artery that goes from my heart to my stomach. Is that what it's? I can't remember what it's called. But that's, well, first I got there and we could not figure out what it was, and they gave me like 3 hits of the really strong medicine that did nothing, and they're like, okay, we've got to take a picture of see what's going on, do a MRI. I'm not remembering all the
well, it's hard for a non-medical person to know in that moment what's happening. It was a celiac dissection.
Celiac artery. Celiac dissection.
What happens during a celiac dissection? What was happening inside Sam?
It's not something that we commonly see, but usually people run through a CT scanner just trying to figure out what's going on. You get contrasted study that lights up the arteries. And the celiac artery goes to the stomach, spleen, liver, and so a dissection is just a tear of that blood vessel, and so it could compromise blood flow to one of those organs, and maybe that's what Sam was feeling.
What would have happened if Sam had just taken Tums and said, I'm going to wait this out? He said it felt like heartburn.
I don't know. It's hard. It's hard to know, predict the future, what would have happened. But obviously, he was treated for the celiac dissection as well as his heart disease in the same hospital visit. So it's not hard to imagine that one of those things could have caught up with him.
And you were called in to perform a quintuple bypass.
Well, he was initially brought here and evaluated further, and that's when they figured out that he had something going on with his heart, and so they get studies to figure out exactly how serious things are. And the roadmap for us as cardiac surgeons when we do bypass surgery is what we call left heart cath, and so it shows us which blood vessels are blocked and which parts of the heart need more blood flow, and so that's what we use to guide how many bypasses we'll likely do. And
so, I mean, as a non-medical person, and Sam, you said this, you thought 4 was the most you could do.
Right.
I've known people who've had double or triple. How rare is a quintuple bypass?
I don't know. I would say, most commonly we're performing, bypass surgeries, 2, 3, 4 bypasses. Rare, we perform 1, unusually to perform 5, but it's really just what is needed, and so that's.
And so in a nutshell, what are you doing during a bypass?
So, you have to get blood vessels to do these bypasses. There are certain parts of the heart and blood vessels that are diseased, and you basically route blood flow around, those blockages. You don't take out the blockages themselves, so those will always be there. And so the artery from the chest wall, the left internal mammary artery, plugs straight in, so it just gets its blood flow from where it came in initially. And then the veins hook up to the aorta, which is the major blood vessel that the heart ejects blood out into. And so
for each blockage, you're physically creating a new path.
A new path around that blockage.
And you got some of that stuff from Sam's arms to create those new paths.
Yeah, that's right.
You're about to show us your arm.
Yes, so there's.
I don't know if you can see that from the camera. We're going to try to zoom in there if you can hold it up.
But it goes from here to here.
It looks very faint now.
Yeah.
You did a good job with the
closure.
with the scar, with the closure and everything.
Are we gonna? You're gonna show the? No. Yeah.
You can if you want. We saw that. You don't have to.
Good.
Oh, it's in the video.
We do have an image of Sam's heart, and I would love to put this up for our viewers. What are we seeing here, Dr.
Yeah, so
Zorn?
this is the left heart cath, and so this is what we look at. And obviously, there's many different projections, angles, and then there's two main coronary arteries that come off the aorta, and the right coronary artery and the left coronary artery. The left coronary artery splits early into the left anterior descending artery and the left circumflex artery. Those have branches. Those are usually where the blockages are. And those,
so can you see the blockages?
Yeah, you can see the blockages.
What should it look like there?
So usually it's just a vessel that is smooth. There's no, there's no irregular, areas to it.
Okay.
It doesn't taper in diameter, but you can see in different areas where it narrows abruptly and then gets bigger. You can use that to determine just how severe those blockages are. And sometimes there's more invasive studies you need to do to get a better idea for how bad those blockages are. But you can see,
and he had 5.
Or maybe you can't, but just how many of those vessels are affected.
That looked alarming. And he had 5
that
were blocked. What's the most you can have blocked and still survive? What have you seen?
I mean, there are multiple different branches that come off of each of these main arteries. So theoretically, you could probably have many blockages. But when we do bypass surgeries, what we bypass to has to be a reasonable blood vessel to sew that new conduit into. And so Sam had 5 reasonable targets for bypass surgery. And so we try and do as much as we can so we can restore blood flow to as much of that heart to allow it to last as long as we want it to. So, yeah.
Sam, you were so honest in sharing. You're a musician. Health wasn't top of mind. You were playing your gigs, getting your fast food, and that was probably for most of your adult life. So do you think these blockages, Dr. Zorn, happened gradually over the years, or is it possible this can all happen at once in a short period of time?
Oh, I mean, for sure these happen gradually over a number of years and decades. These are probably happening early in our life than we would like to think they are. And so sometimes, blockages, progress very rapidly, and that's when people have major heart attacks, end up in the hospital, very quickly proceeding to the cath lab for things like stents. And other times, these blockages happen over time, years, decades, and they get to the point where they're affecting you in a more chronic way. You're becoming more fatigued, you're having chest pain when you exert yourself, or other symptoms. So.
Do you think your family noticed that your health was starting to slip before you did? Was anyone saying, hey, I met your daughter when we first met you.
Yeah.
Was she like, Dad, you got to start eating healthier. You got to go for walks.
A little bit, but our family is a family of bakers.
Oh, right. It's hard to cut back
So
on
we're
anything.
all kind of baking for each other, and
Right.
love is food, and my
Right.
mom and both sides of our family are food equals love. So we really had to change our lifestyle together, and that made a big difference. So I'm surprised that people have come to the club and seen me and said, wow, you like you said, your color looks so different.
And you look more
I didn't
trim. You've
realize
been
that at the
working out.
time you looked pale and you just didn't look as healthy as you do now. I think like I said before, I think we get used to our own skin and how we're living, and we get in these habits and we just keep going, instead of like thinking about, I think people need to think often about, what you're eating, look at the labels, and exercising and drinking lots of water. So.
Have you been able to, you said food is love, and food is such an important part for so many people, and it is love for so many families. Have you found ways around that to bake differently, to make different recipes and things?
Exactly. Yes. We've gone through and tried every sugar substitute and stevia and different things, and we've had some luck, but really it's mostly we've been cutting back on desserts, and food is love could be as a different, like a salad or Mediterranean diet where it's a little more healthy option. So
Making a creative meal.
yeah.
For you, music is your life. That is clear.
Yeah.
Did your playing have to pause for a very long time after the surgery because they had to take things, harvest from your arm because Dr. Zorn had to do that?
A little bit, but a lot of it was the overall recovery from surgery and just building up my stamina. PT was amazing for getting that back. And friends came out to visit and we would jam just a little bit. But I was kind of ready to go because when I had the heart attack, I was working on some new songs that a friend had written at Green Lady, and those like stayed in my head and were on repeat. So it was pretty soon after surgery when I was laying in the bed recovering, I was already at least practicing in my mind, and then I would turn on my phone or tap, I was like, okay, I got to get ready for the next gig because we're going to play these songs. And they're like, whoa, just no hurry.
Take it easy. Your gig will be there.
Yeah, exactly. That's what they said. Then, yeah, it's yours when you get back. So
it's such an interesting story, and I think it's super interesting that you harvest from the arm. Do you always have to do that? And are you always asking them when they're there, say, hey, do you mind if I take this from your arm?
Yeah, no, we talk about it. We've found more and more that, especially in younger patients, that if we can do more what we call arterial conduit, so there's arteries and veins, and the arteries are much better suited to handle, that degree of blood flow at a higher pressure, and so we see that these vessels last longer over time. So for younger patients, it makes more sense to take arteries from the arm or another artery from the chest wall on the right side, because we think that will increase their lifespan. And so the veins are good and they do well, but they have a shorter time period that they stay open.
We're getting questions from our viewers already, and we love our questions from our community because they're really the heartbeat of our program. So right now you can take some time and send your questions to us on YouTube, Facebook, the X platform, or the All Things Heart email. You connect with us in real time when you send messages there. All the links are right there on your screen. So I want to go to some of the questions already submitted from our viewers. And Brett wants to know, what are the symptoms of a blocked artery? Is there a test that would have detected this earlier in Sam?
Yes, I think we touched on it a little bit, but chest pain, shoulder pain, jaw pain that's new, mostly with exertion, is probably the more common symptoms. Just being more fatigued over time, being able to do less. Sometimes, like in Sam's case, you can actually present with GI complaints or heartburn as some of the first signs. Are there things that we could do to prevent it? And we talked on that too. Eating healthy, going to see your doctor, being on the right medications based on your lab profile or your blood pressure can really probably slow the progression of the disease, because like we talked about, this is something that builds up over time.
Is there a scan that people watching could request the next time they're at the doctor?
I mean,
see if they have
request is a strong word, but I think as you go to your physician and you engage with a cardiologist, the suggested scans may be like a calcium score, or if that's bad, a stress test, and these things will kind of lead you down a path of looking at this before kind of it rears its ugly head.
And we offer calcium score tests, obviously, here. We've done segments and stories on that as well, and our boss took one. She was very happy to score a 0. Only test you want to score a 0 on. Sam, Gretchen has a question. She wants to know if you're all done having surgeries, or have you been told that the veins will be good forever?
I'm done with surgery, but Dr. Zorn said, is the average like 10 or 20 years?
Yeah, I think the average, the veins are patent, is about 10 years. Certainly they can last much longer than that, and hopefully yours do, but ultimately if 1 or 2 goes down, it doesn't necessarily mean he needs to head back to the operating room, or it doesn't necessarily mean that he will even feel it. As disease builds up over time, the heart can learn to get blood flow from other places, and hopefully.
So the veins you took from his arm, you harvested and put there, they last for about 10 years?
The veins we usually take from the leg.
From the leg, okay.
And those last on average about 10 years.
What about what you took from Sam's arm?
Hopefully that will last as long as, the artery from the chest wall that we take the lima, but could last, hopefully for the rest of his life.
It'd be amazing. Corey has a question for you, Sam. He writes, you were running on fumes before your surgery. Have you needed to cut back on gigs?
No. Well, I built up to it. I think it was in October, which was pretty soon. I was still in the middle of PT that I started getting calls like, hey, how are you doing? And I'm like, oh, we should jam sometime. And Ken was like, how about tonight? So I put on my tie and went down there and called my wife, and she's like, you're going to the gig, aren't you? And I'm like, yeah. And she's like, well, I'm coming down there because you're not driving home.
To monitor things.
Right. So I lasted about 2 hours on the first gig until my friend Brian could come up and relieve me.
Were you feeling tired?
Oh, well, I was fine until I saw him over my shoulder, and then my body was like,
really?
Okay, he's here, you're done.
Right.
So yeah, all of it is a gradual build back up to just like you have a regular job where you work 5 days a week. I just happen to work at night.
What do you eat? You mentioned you were doing fast food every night. Do you bring your own snacks now?
Yes, or I take care of it before I go down there. I don't eat any fast food, no pop. So I'm water, tea, plain tea and coffee. But yeah, basically I make I'm kind of a snacker. So instead of 3 big meals, I sort of have kind of one real meal, but most of the time I have my little vegetable sticks or a protein bar or something I can grab and take in the car with me, but it's better than fast food.
Sure, yeah. And you probably have a better budget now.
Oh yeah, we've saved lots of money doing it.
It adds up. Jeremy, our Facebook viewer, writes in, what are the ramifications for the parts of the body that provided the veins for the surgery that now have less veins?
Yeah, so for the arm, there's a radial artery and an ulnar artery. We take the radial artery as long as we can verify that the ulnar artery has enough blood flow to supply the arm and
where's the radial artery?
So the radial artery runs down the outside.
The outside, here, so that's what you took?
And the ulnar artery here. So we make sure the ulnar artery will be able to supply the hand safely after surgery. If we do that, we can safely take it without any ramifications. And the veins, similarly, the saphenous vein graft that we take for bypass grafts, it's a superficial vein, and so the other veins in that leg usually make up for the work that vein did. So there can be a little bit more swelling in that leg post-operatively, but usually that gets better with time.
Did you have swelling in your hand or your arm?
Not much, a little bit, but no.
Went away.
Yeah.
Carrie has a question, Sam. Carrie wants to know, where is Sam playing next? My husband and I want to go see him.
All weekend at Green Lady Lounge downstairs. This weekend we're down, it's late. Friday and Saturday is 11 p.m. to 2 a.m. But Sunday I'm playing with Tim Reed. He's a singer, piano player that moved here from Chicago. And it's the same place downstairs at Green Lady on Sunday, 8:30 to 11:30, so that's not quite as late. So,
right.
Yeah.
So you got two options for your next 2 gigs.
Yeah.
When do you sleep? What's your schedule like? I'm always interested in people's sleep schedules.
I mean, if it's 2, it takes me an hour to get home and then get ready for bed. And sometimes I take little cat naps.
Yeah.
But I'll sleep in the morning a little bit when my wife goes to work, and then I'll wake up and go walk. So,
take your walk, do your exercise.
Yeah, I get up and walk, so.
Gary has a great question for Dr. Zorn. He wants to know how many doctors are involved in the surgery, and does Dr. Zorn remove the veins and arteries, or is that someone else?
Yes, so we have, there are multiple doctors involved with the case. There's an anesthesiologist and myself usually. We usually have physician assistants that help us with conduit harvest as we get the artery from the chest wall. Most of the time it's the surgeon that's doing that. The physician assistants will work on the artery from the arm or the veins from the legs, so that we all do it in concert.
In concert? Mm-hmm. How long does this whole process take? Like, how long were you standing over Sam working on him?
The whole surgery?
Everything, yeah.
Probably about 4 hours. So.
And is that one of many you'll be doing in the day, or is that your big thing for the day?
Yeah, there's usually probably no more than 2 in a day. Most of the time, just 1. So.
That's a lot of standing. What shoes do you wear?
just regular
Joggers,
tennis shoes.
tennis shoes.
Yeah.
You're not going to want to be
Yeah.
in dress shoes for that.
No.
Got to be in comfy shoes. This is such an interesting topic, and I just love, Sam, that you're here today, and you look amazing.
Oh, thank you.
When it comes to final thoughts for our viewers, what message would you want to send to other people who might be burning the candle at both ends as well, just like you before your emergency?
Stop and take a breath and get your heart checked. Because I just kept going to the doctor, and they would be like, "You're fine, good to go." But until we did that cath, until you have a camera in there, I don't think you really know exactly what's going on, right? So I would just, have it on your mind and try to eat more healthy and walk as much as you can, drink lots of water. So.
Is that your same advice to
Yeah,
viewers?
I mean, I think, Sam is the ideal patient now, and what he's doing now is, what we should all be doing, for the majority of our life,
It must feel good to see a patient so compliant
Right.
with everything. Have you
makes
ever been
things
called
easier.
compliant
Yeah.
before?
Never. I'm a jazz musician.
He's a compliant patient and an excellent jazz musician. We love sharing the incredible work that our doctors like Dr. Zorn do here at the health system. We also love showing you what life looks like for them outside of the hospital walls.
Now for a secret look into the guardians of healthcare at the University of Kansas Health System. Let's go behind the mask.
We are going behind the mask with Dr. Zorn, who has the cutest family ever. Tell us about your family.
So my wife, Cassie, we've been married, for
We better get this one
18
right.
years now.
18? Okay.
Yeah, and we have 4 kids. My oldest daughter, Cameron, is 16, about to be 17 years old, a junior in high school. Preston is in middle school. He's 13. John is 11. He's in elementary school, and then we have Levi, who's our 4th one.
You're
7,
not busy at
yeah.
all at home, are you? No
It's
chaos.
usually as busy as at home as it is at work. So.
This is Heart Month, and we also, we need a soundtrack to go with Heart Month. So I'd love to say this. Hit it, Sam. We want to celebrate the cardiology department's growth. As you know, the health system just celebrated its 25-year anniversary. What are you playing, by the way? Oh, you got the tambourine? This is amazing. Okay. Before Mid-America Cardiology transitioned to the health system in 2000, the health system had 3 cardiologists on staff. Now we have nearly 60 cardiology physicians and hundreds of support staff, all focused on providing incredible care to our patients like Sam. Hats off to the entire cardiology team. Hats off to Dr. Zorn. You might be a musician too. How's his beat?
It's great.
You think he has potential, or should he not
man,
quit his
good
day job?
Come down.
You play too late, I think, for me.
Exactly.
You come down between surgeries.
That's when the kids go out, is late at night.
That's true.
Thank you so much for joining the conversation today. Thank you to Dr. Zorn for making time. I know you're busy. We know we got you up probably earlier than you ever get up instead of doctor's appointments. You're here, though. Thank you. You look amazing, Sam.
Thank you for having me.
We appreciate it, and you look fantastic. I can't wait to see you play at the Green Lady. Coming up next week on All Things Heart, back-to-back diagnoses led this patient to make some serious life changes. You'll see the workout she developed focused on the heart that is so successful, other doctors are prescribing it to their patients. That's next Thursday at 8 a.m.
Coming up tomorrow on the Morning Medical Update. Carpal tunnel syndrome. Leave it for too long and it can lead to permanent damage. But several new surgical techniques offer relief. I'm Jessica Lovell on the next Morning Medical Update. See how ultrasound leads to less pain, faster recovery, and allows patients to stay awake and watch surgeons do their work. Friday at 8.